Which of the following is false regarding the respiratory system of pregnant women? A. There is increased metabolic demand for oxygen from the body. B. The rib cage becomes slightly more compact. C. Total lung capacity decreases. D. Oxygen consumption is increased. E. The diaphragm elevates. The answer is B. The rib cage becomes slightly more compact. In pregnancy, the ribs start to flare, expand slightly, as the pressure from the growing fetus moves the diaphragm upwards. Many women experience this during the third trimester as the baby is at its largest. The flaring of the ribs is assisted by maternal hormones that enable more flexibility throughout the body. Which of the following reasons does not indicate the need to induce labor? A. Post-maturity. B. Diabetes. C. Fetal jeopardy. D. Fetal macrosomia. E. Gestational hypertension. The answer is D. Fetal macrosomia. Induction of labor may occur for various indications: diabetes, post-maturity, hypertensive disorders or pregnancy, fetal jeopardy, or logistical factors including distance from qualified hospital or a rate of rapid birth. Induction of labor may only occur if the mother does not have cephalopelvic disproportion, CPD, the fetus has a vertex presentation with an engaged head, and the mother has a ripened cervix or is prepared to be ripened. Fetal macrosomia is a concerning condition and may require intervention, but is typically not resolved by inducing labor. With fetal macrosomia, a cesarean section may be considered instead of vaginal delivery, due to the potential risks of delivering a large infant vaginally. What is the most common form of female reproductive tumor? A. Choriocarcinoma. B. Uterine leiomyoma. C. Yolk sac tumor. D. Endometrial adenocarcinoma. The answer is B. Uterine leiomyoma. The most common tumor of the female reproductive tract by far is uterine leiomyoma, also known as a uterine fibroid. Uterine fibroids are benign smooth muscle tumors that grow into the myometrium. They can often cause pain in the lower back or pain during penetration, dysmenorrhea, and menorrhagia. Sudden onset of severe abdominal pain with a unilateral adnexal mass would most likely be which of the following conditions? A. Polycystic ovarian syndrome. B. Teratoma. C. Pelvic inflammatory disease. D. Ovarian torsion. The answer is D. Ovarian torsion. While any of the conditions listed can cause abdominal or pelvic pain, the most likely cause of severe pain of sudden onset is ovarian torsion. This is an emergency condition which can result in loss of the affected ovary if not treated within 4 hours. Clear cell adenocarcinoma of the vagina is strongly linked to pre-birth exposure to what medication? A. Acetaminophen. B. Diethylstilbestrol, DES. C. Clomiphene. D. Thalidomide. The answer is B. Diethylstilbestrol, DES. Diethylstilbestrol, a medication used from 1940 to 1971 to reduce the risk of miscarriage, resulted in the later development of clear cell adenocarcinoma in many of the unborn children of these pregnancies. A patient enters the labor and delivery unit. She is having a singleton birth and the baby is showing minimal variability on the fetal monitor. Interventions may include all but A. Giving the patient a 500 ml IV fluid bolus. B. Placing the patient flat on her back. C. Contacting the provider. D. Placing the patient on a non-rebreather mask. E. Suggesting that the patient walk with a portable monitor. The answer is B. Placing the patient flat on her back. Increasing fluid and oxygen administration may increase the overall oxygenation of the fetus and result in greater variability in heart rate. It is advisable to change the position of the patient, however, a supine position is not compatible with pregnancy. Contacting the provider is an acceptable intervention given concern for fetal well-being. What is the most common cause of mucopurulent cervicitis? A. Chlamydia trachomatis. B. Nclex gonorrhea. C. Herpes simplex virus. D. Human papillomavirus. The answer is A. Chlamydia trachomatis. The most common cause of mucopurulent cervicitis is Chlamydia trachomatis, followed by Nclex gonorrhea. Human papillomavirus, while it is associated with increased risk of development of cervical cancer, does not cause mucopurulent cervicitis, nor does herpes simplex. Which of the following conditions can result in temporary masculinization of a pregnant woman which resolves after delivery? A. Placental ematase deficiency. B. Growth hormone deficiency. C. Closma. D. Polycystic ovarian syndrome. The answer is A. Placental ematase deficiency. Placental ematase deficiency is a condition that prevents testosterone from being aromatized into estrogen during pregnancy. This results in a temporary masculinization of the mother that does not continue past delivery. Neither closma nor growth hormone deficiency result in masculinization, and masculinizing symptoms of polycystic ovarian syndrome often improve during pregnancy, rather than getting worse. Which of the following conditions presents as vulvar pruritus and pain with porcelain white vaginovalvular atrophy? A. Bacterial vaginosis. B. Lichen sclerosus. C. Contact vulvitis. D. Herpes simplex. The answer is B. Lichen sclerosus. Lichen sclerosus is a condition that presents as vulvar pruritus and pain with porcelain white vaginovalvular atrophy. It is most common in postmenopausal women, though it does occur on occasion in younger women and girls. While all of the other conditions listed can cause pruritus and pain, none of them are associated with frank atrophy. All of the following are part of the EMSL criteria for bacterial vaginosis except A. Thin gray or white vaginal discharge. B. Vaginal pH greater than 4.5. C. A positive whiff test on addition of potassium hydroxide to the vaginal discharge. D. All of these are part of the EMSL criteria for bacterial vaginosis. The answer is D. All of these are part of the EMSL criteria for bacterial vaginosis. The EMSL criteria for bacterial vaginosis are as follows: clue cells seen on microscopic examination, a positive whiff test on addition of potassium hydroxide to the vaginal discharge, a vaginal pH greater than 4.5, and thin gray or white vaginal discharge.